surprising number of patients require the support of assisted reproduction techniques in order to become parents, with egg donation treatments playing a major role. These patients choose the professionalism of Instituto Bernabeu to achieve this goal. Fully aware of the great responsibility that comes with the trust that these patients place in our team, we start a rigorous donor selection process to ensure the highest quality and the best results of it. Psychological assessment conducted by a clinical psychologist who is expert in helping patients undergoing assisted reproduction. The evaluation includes a personal interview and the application of our EMAE psychological assessment questionnaire. This questionnaire is designed to understand the person's individual personality traits and to analyze the differing aspects, for example, emotional, social, and so on. We can then predict types of behavior such as emotional stability, assertiveness, responsibility, levels of common sense, interpersonal skills, selflessness, trust, absence of depression, self-confidence, and resistance to anxiety. Most women have proven fertility. The next step comprises of a complete battery of blood tests to rule out certain serologies such as HIV, hepatitis, and syphilis. Although Spanish law requires a serological analysis for donation, Instituto Bernabeu applies a more comprehensive selection process. A comprehensive genetic study including karyotyping, and a study of genetic inheritance which rules out the most common hereditary diseases and so preventing their transmission. This process is managed by our genetics department, IB Biotech. Once all medical analyses have been passed, the gynaecologist takes over and performs medical and gynaecological examinations to assess the egg donor's response to treatment and to rule out any further medical conditions. If these tests are passed, the egg donor can become part of our donor bank, awaiting a recipient mother with similar physical characteristics. This donor allocation process is key and represents a multidisciplinary effort encompassing the correct synchronization between the parallel treatment of the egg donor and the recipient mother. The process is managed by the international care assistant, who liaises between the egg donation department and the patient. Special focus is placed on blood group and type, hair type and color, eye color and skin tone, height and weight. At Instituto Bernabeu, the egg donor is looked after with the same care and professionalism as any other patient. We respect the importance of her donation, which represents the cornerstone of our success. Like any other patient, she is part of our quality control process and fills out quality questionnaires to evaluate our processes and care levels. The recipient mother, thanks to the most rigorous process at Instituto Bernabeu, receives a donation of an average of 9 mature eggs. She does not have to worry about waiting lists and can be reassured by the information that she receives relating to all the analyses and testing that the egg donor has undergone.
Egg donation is regulated in Spanish law as a free, formal and confidential contract between the donor and the offering site center. It is important to note that the law demands that the medical center preserve all times the anonymity of the egg donor. That is, not to disclose their identity except in extraordinary circumstances set out in the law where there is danger to the life of the child born for the donation. The law also states that the choice of donor is always made by the center and that each donor can have a maximum of 6 offsprings, including their own.